wellness event. I'm happy to see all of you. Today we're talking about wellness during COVID and vaccination information, and we have some pretty amazing guests here with us today. As we're beginning, I'd like to give a brief intro. Shojrit Rochelle Adams Oji, Gwichaje, Tsendukwatanisi, Juk Anchorage Gwichi, Dilak Nai Dena Ina Nai Nanpo Anditi, Native Peoples Action and Chugutrik in Indigenous Engagement Director Ishi. So, hi everyone, my name's Rochelle Adams. I'm originally from the villages of Fort Yukon and Beaver, and I'm living here in Anchorage now on the homelands of our relatives at Denaina. And I'm the Indigenous Engagement Director for Native Peoples Action, and I'm going to toss it over to my co-host.
Dan Hizun, Lena, Benozalio, Jacob, Sauza, Tla Aloga, Hutzan, Sadantale, Dagayakak Listo. Hi everyone, my name is Lena Jacobs. My Danaka name is Benozalio. I'm originally from the village of Ruby, but I live in Anchorage on Denaina land. And I'm really excited to be co-hosting this series with Rochelle and just welcome you all to this virtual learning and community building space. And we'll invite you guys to share your introductions in the chat box to let us know where you're calling in from, what drew you to the space, and we just welcome you.
Basi, Lena. Yeah, so as we're getting started, I'd like to hold space to acknowledge the Indigenous homelands that we're all zooming in from and joining on Facebook Live. So let's just take a moment and give gratitude to the original stewards of this land and say, Masicho, Kuyana, Anabasi, Bunalshish, Gaasakung, Kuyanapak, to all of our first people, the original stewards of this land, and the past and into the future. And to hold that acknowledgement with us in our days, in whatever spaces that might take us, and to walk upon this land in that gratitude. So again, Chinan, I'm zooming in from Anchorage, and like I said in my language, this is the homeland of our relatives, the Denaina, so Chinan to them. With that, I just wanted to give an overview. As you know, these wellness events are a quick hour, and so we're about to turn it over to our guests. But I just wanted to let you know we'll have a Q&A session towards the end. So we want to make sure everyone has a chance to ask their questions, and we'll be monitoring the chats on both the Zoom and the Facebook Live for you to have an opportunity to ask some questions. And with that, I would like to share a native wellness word of today. And in my language of Gwitchin Athabaskan, the wellness phrase that I would like to share is Shalaknai, and that means my people. And Govet Ethan, that means I love my people. And so I think, that's why we do these wellness events. And with that, I'll hand it to Lena to share her wellness phrase as well.
My wellness phrase is in Danaka, otherwise known as Kwaikan Athabaskan, spoken by folks on the Central Yukon River. And it's Nala Itonlach. Very practical COVID phrase. Wash your hands. Nala is hand, Itonlach. Wash your hands. I also just want to take a quick moment to set the intention for this space. We started creating this online space and these wellness events back in April in response to the pandemic, and just really feeling the call to create a place where we can really uplift our wellness, grounded in our values and our traditional ways of life, and to continue to build community while so many of us were in isolation and just needing like these personal connections, and to just take these timeouts in our very busy Zoom world schedules to remind ourselves to be well and to learn about wellness and practice wellness together in community. And so it's our intention that we uphold that in this space with love and respect, for one another, responsibility to one another, and speaking with care and holding one another up and just infusing all of our good energy to you through this event. So just wanted to set that framework and just really show our gratitude. We've had so many amazing speakers who have volunteered their time to join this space and share their knowledge and their expertise and uplift us all. And we're so excited today to have Representative Tiffany Zulkosky, Dr. Lisa Rabinowitz, and Dr. Ellen Hodges. And I will pass it on over to you guys to further do your introductions and guide us through the next 45 minutes on our topic of COVID, safety, wellness, information on what's happening with vaccinations, and just we're really looking forward to learning from you guys this hour. So Anabasi, Koyana for joining us.
Guyana, thank you so much, Lena. Maybe I'll just jump in here just to do an introduction. Hi, everyone. My name is Tiffany Zulkosky. I proudly represent my home district of House District 38 in the Alaska State Legislature. But when I'm not here in session, I am Dr. Ellen Hodges' favorite thorn in her side as the Vice President of Communications at the Yukon-Kuskokwim Health Corporation. I worked side by side with her during the interim on COVID-19 response and making sure that we were sharing important public health information to our tribes, to our region, and continue, even though I'm not a physician, continuing to advocate for our COVID-19 protective measures, but also being a champion for COVID-19 vaccination. And I'm just really privileged to join this incredible group of women and this incredible organization for this hour today. And I'll hand it off to, I think, maybe Dr. Hodges and then Dr. Rabinowitz, if you want to get us started.
Sure. Hi, I'm Ellen Hodges. I'm a family medicine physician and I work in Bethel, Alaska. And it's a privilege to work with Tiffany. In fact, I'm the thorn in her side. And really been through the trenches in these past few weeks, and I'm grateful to be here and happy to answer any questions that people have.
Hi, I'm Lisa Rabinowitz, and I grew up in rural Alaska, and I'm an emergency physician, and I've been at Providence for almost 19 years. It kind of hurts to say that. But I'm also helping the state of Alaska Public Health on their COVID task force, and my kind of role has been vaccine education and outreach. So we thought we'd start off this hour with a short little slide presentation and kind of go through some vaccine slides so we can kind of just all be on the same topic, and then we'll kind of open it up to question and answer, and I think Tiffany's going to give us kind of a legislative update on what's been happening. Can everyone see this screen? Perfect. So we're just going to dive in. And again, this is a short presentation. You guys have had Ann Zink on in the past, and I know that you guys have worked hard on educating yourselves already, but let's just run through a quick slideshow. So we've got 3 vaccines now, and the really cool thing is that all 3 vaccines we know are very efficacious. They work very, very well, and they're also very safe. And we know they prevent severe COVID. That means not being on a respirator, not in the ICU, and also death. And so we're pretty excited to kind of be able to say that out loud and talk about it. For many of you that have already been vaccinated, this won't be news to you, but there are some common side effects to the vaccine. And that's usually in the first 1 to 2 days after the vaccine. So you do get some pain right where your injection is, somewhat like a flu shot. You can also get muscle aches, headaches, fevers, fatigue, usually up to the first 1 to 3 days. With Moderna, we found that people are having some, like a week after their injection site will become sore again, and sometimes get a little bit swollen. The important thing to note is that all of these side effects mean that your body is mounting the immune response that we want it to. So even though it doesn't feel the best, this means that it's working, it's doing its job. the flip side of that is there's lucky people that don't get these symptoms after they get vaccinated. It doesn't mean it's not working. It's still working. You're just one of the lucky ones. I think it's fine to take Tylenol or ibuprofen if you do have some symptoms after your vaccination. We're kind of asking people not to take it ahead of time because theoretically that could kind of blunt your immune response that you're going to have to the vaccine. So I think one of the important things to talk about is kind of this adverse reactions, which are very rare with all 3 vaccinations, but we know that allergic reactions happen. Alaska, we were one of the first places in the US to have the first 2 anaphylaxis or severe allergic reactions in the country, and that was in Juneau. And because of the information that we were able to give to the CDC and nationally, they changed the whole rollout for the vaccine program. And now there's extended training anywhere that they're giving the vaccines. There's epinephrine or EpiPens that are used to treat allergic reactions. And they started monitoring people that have had allergic reactions or reactions to vaccines in the past longer period. So you'll have 30 minutes after your vaccination where people kind of watch you. Someone who hasn't had an allergic reaction, they'll watch it for about 15 minutes. Again, these allergic reactions are very rare, on the order of 2 to 6 per million people getting the vaccine. And it's important to note that everyone who's had an anaphylaxis reaction in the United States has been treated appropriately, discharged from the hospital if they needed hospitalization, and no one has died from this. And so we'll move to the next slide. These are kind of our 3 vaccines, and you guys have probably heard all about these, but the cool thing for all 3 of the women here speaking is that we can roll it out to everyone that lives or works in Alaska. And so unfortunately, kids cannot be vaccinated yet, but it's coming, and we can talk about that in the Q&A. So right now, Pfizer is approved for anyone 16 years and older. And Pfizer is 2 doses, and you get your second dose 21 days after the first dose. Moderna is for 18 and older. Again, this is also the 2-dose series and 28 days to the second dose. And then the Johnson & Johnson Janssen, which is our new tool in our tool belt, is also for 18 and older, and it's just a single-dose vaccine. These slides are on here really to just remind people that we consider you fully vaccinated 2 weeks after your last vaccine. So if you're in a 2-part Moderna or Pfizer, it's 2 weeks after your second dose, or for Johnson & Johnson, it's 2 weeks after your dose. But this is to remind us that you're still improving in your efficacy of your vaccine, even up to 6 weeks out. So just an important reminder that you're still building that immunity. And we know for the Johnson & Johnson vaccine, at day 48, there were no hospitalizations, no deaths, no cases. So absolutely no cases after 48 days, which is very exciting. So just this last week, the CDC has now put out guidelines. This is kind of our light at the end of the tunnel. So now that we're vaccinated, we're starting to loosen up some restrictions in terms of mitigation for COVID. So we can now gather indoors with other people that are fully vaccinated. And again, fully vaccinated is 2 weeks after that last dose, and not wear a mask. You can also gather indoors with unvaccinated people from one other household without masks. So that opens it up. We can give our grandparents hugs. We can get together with another family that's been vaccinated, have dinner, all these things that we're all starved for and are important for our mental health and wellness. And we'll move to the next slide. So I kind of mentioned the vaccine as our tool in our tool belt, and that's really what it is. And right now it's probably our most important tool as we try to get immunity throughout all of our communities. But we can't lose sight of still making sure that we're wearing our masks, social distancing, hand washing, all those things that we know are so important and work. So keep going. We get the question a lot about testing. How did this happen so quickly? And these are great questions. These are appropriate questions to have. I think every physician in the United States had these questions before we decided to get ourselves vaccinated. And all three of these drugs went through the most rigorous testing in the world. And phase 1, phase 2, and phase 3 were all completed, and these were approved. It's important to note that there were American Indian and Alaskan Native populations in each of the 3 drugs that have been approved. So we do have some data from that. We can kind of talk a little bit more about some misinformation in the media around Johnson & Johnson and Native communities in the question and answer. So how did they happen so quickly? That's another question we get a lot. And I think a lot of this technology was worked on before we knew about COVID. So with SARS and MERS, they had everything ready to go, especially for these mRNA vaccines. And the federal government also helped subsidize these drug companies to get them rolling faster. They also, in the same time they were doing the trials, they were making the medication. So if it did work out, if it was approved, we would able to roll it out to people right away, because we know how much they save lives. This is kind of what we were talking about. We're going to move to this next slide really quick, and this is just more of a safety check. I like to remind people that, you know, there were 40,000 roughly patients in each of the clinical trials for the medications, but we now have over 300 million doses given in in the world, and over 70 million cases in the US. Sorry, not cases, vaccinations. So we have all this safety data now coming in, and there have been no new safety concerns that came out after rolling out millions and millions of doses. So that's very encouraging. However, nobody's taking their eye off the ball. We want to know about any adverse events. So on the left is this VAERS, V-A-E-R-S, and that's if anyone has any adverse reaction, anyone passes away, even within a month of getting the vaccine, even if it's totally unrelated, it all goes into this reporting so the CDC can investigate it and make sure that there's no safety concerns coming up. Be Safe on the right is an app that we ask people to check into after they're vaccinated so they can kind of update the CDC with their personal experience. And then on the bottom is just talking about, again, the anaphylaxis, and that we have a response box at each place. So kind of what to expect at your appointment. These vaccines have all been paid for, so they're free. The federal government, tribal health have partnered to make sure that nobody has to pay for these medications. If people do go, especially in the larger cities, to a retail pharmacy to get vaccinated, they sometimes will charge your insurance for their administration fee, but not for the vaccine itself. All of the large vaccination clinics or municipal, county, and tribal health clinics, you won't have your insurance charged at all. Just a reminder, still wear your mask, and then we talked about the observation period. I think it's important to realize we're vaccinating for ourselves, but also community. We're vaccinating for our elderly neighbor, for our family member that's at higher risk, and this is how we're going to do it. And they estimate we need 70 to 80% of our communities vaccinated to kind of get that herd immunity to protect everyone. So it's kind of, we need to continue working as we have throughout the whole pandemic. At the top of this slide is the State of Alaska website to make appointments. And on the right-hand side is a hotline number with a live person. So if the computer is difficult for people, elderly people, or just having trouble navigate getting an appointment, call that hotline and they can help. And Ellen can probably speak a little bit more to tribal health and how that's rolling out, but especially in Anchorage, South Central Foundation has their own website, and I assume most communities have that as well. And Tony will put those in the chat box so people can have those. So let me stop sharing this, and then I'll throw this back to my colleagues, Tiffany and Ellen, who are on, and then we can open it up to questions later and talk about vaccines.
Thank you, Dr. Rabinowitz. I just want to start by sharing that I was very grateful to be vaccinated against COVID-19 through Alaska's tribal health system. This morning in the House Tribal Affairs Committee, we did a hearing with representatives from ANTHC. Dr. Hodges presented for YKHC. We had folks from Search, from Norton Sound Health Corporation, all coming forward to talk about the role that tribal health has played in COVID-19 response, both through widespread community-based testing, but also through vaccination most recently, and response to the pandemic. Within my home region of the YK Delta, we received Pfizer, an allocation of Pfizer vaccine as early as December 16th. Vaccinations began immediately and are continuing to be ongoing. And I want to acknowledge that COVID-19 vaccination has, and the ability for Alaska to be so responsive in expanding eligibility early on, I really believe is in large part to our tribal health system. As Dr. Rabinowitz mentioned, a lot of the tribal health providers, so if you're located in a community that's served by tribal health, reach out to your regional tribal health organization, because they likely have their own forms for you to be able to quickly access COVID-19 vaccination at your opportunity. Before the state had acknowledged that they were opening the state allocation to anyone 16 and older, South Central Foundation, Search, all those tribal health facilities, particularly in larger communities of Alaska, were vaccinating non-native members of a beneficiary household. There were a lot of opportunities that eligibility for vaccinations had occurred. And I think I am in good company in understanding that the disproportionate investment of the Indian Health Service through COVID-19 vaccination allocation in Alaska has really set up Alaska for success for this opportunity. And so maybe I'll pause there to see if Dr. Hodges wants to add anything, and then hand it over for any questions.
Sure. Yes, I think I would just echo some of the things that Dr. Rabinowitz mentioned about the importance of vaccination, protecting the community as well as yourself. That's really important. We can't vaccinate many people in our region. Half our population can't be vaccinated because they're young. It's the rest of us have to kind of pick up the slack until we can vaccinate kids. So that's an important part of the vaccination push. And I agree that the generous allocations and the hard work that was done on a federal level and a state level to get us the vaccination allocations from both the Indian Health Service and the state of Alaska is really what allowed us to vaccinate as many people as we have, as rapidly as we have. And we saw an immediate and dramatic increase in our cases as soon as we started vaccinating. And so just remain very, very grateful for all of that. And I do think that people are worried about vaccine. There is historical trauma in our region and in many parts of the state associated with our healthcare that has been provided in the past. So I am very understanding of all of that and happy to engage anyone in any questions about the safety and the efficacy of this particular vaccine for our particular people who have been hit so hard and so unfairly with this virus. I think that's an important thing to remember, is that Alaska Native peoples are far more likely to both catch COVID and, if they catch, unfortunately die from COVID. Alaska Natives are disproportionately represented in those two categories. And so as much as we can protect ourselves and each other by vaccination, the better off we're all gonna be. So happy to answer any questions.
So I think that's a perfect lead into our question and answer. And I think, as I said before, it's healthy and normal to have a lot of questions about vaccines and to educate yourself so you feel comfortable with your decision, and also being able to share your experience and educate those around you. because it takes a team to get this done. There are people now, doing a buddy system. If somebody's uncomfortable or doesn't want to go to the vaccination site themselves, they're kind of buddying up to do this. And there's lots of really creative ways that different communities have kind of rallied around this. So I know Ellen and myself answer questions all the time in vaccines, and Tiffany's out there championing our cause all the time. So no question is a bad question. And I think this should be fun. We'll just open it up and have discussions about vaccines. And if we don't know the answer, we'll tell you, but hopefully we can get some good information out.
Great, thank you so much. Yeah.
Does someone want to start the question?
I'd like to ask a question and just remind everyone, feel free to jump on the video or share your questions in the chat. We also have the Facebook Live, we're monitoring that. I would like to know more about herd immunity and kind of how that works and the role the vaccine plays in that.
Sorry. So that's a great question. Sorry, I'm trying to unmute myself. Herd immunity is kind of our big goal right now. And I think Ellen said it the best. Already we've seen as our vaccinations have rolled out, and statewide, I think we're at 27% of our population has now been vaccinated. We're starting to see those cases come down. We're now getting a bit of a plateau, and that's really where we need to bring up those vaccination rates for the whole community. The CDC estimates 70 to 80+% is what we need to kind of decrease that transmission around our community. So if we can stop this virus in our tracks, we won't have that widespread kind of continuous infection. The other thing that I'm gonna bring up is variants, and we can kind of talk about that, but these viruses are smart. They're very smart, and they change their genetic structure a little bit. And some of these viruses have made it harder for our vaccines to capture them, and make our immune system as robust as it was to the native COVID, we'll call it. So some of the South African variants, Brazil variants that we do know that we have in our state sometimes can cause a little more severe disease or transmit further. So bringing those vaccination rates up, we can hopefully stop this before we get widespread variants in our communities, which may be harder to treat and harder on people's health. Great question.
Yes, Masi Cho for the answer. Anyone else have any questions here?
Yeah, this is Mike down in Cape. To maybe continue that conversation in regard to herd immunity. We're over 6%, and with, I think the Johnson & Johnson vaccine is next week, and some of the people are opting in on that. I'd say about 20, which would put us up into the 80s. How worried should we be in regard to our children or our grandchildren attending school? They're opening it up, but next week it's all going to be their late spring break. But people I know are up in Juneau coming back home after shopping when the ferry started to run. Should we be pretty worried about the children yet, as much as we were when we were all locked down? Thanks.
Yeah, so Mike, this is kind of that great question as we try to dive into wellness and opening schools back up. We know child mental health has been a big issue. So first of all, kudos to CAKE for having such high vaccination rates. That's phenomenal, and I'm so proud of the community. I think getting your most fragile residents of the community vaccinated, your elderly, your at high risk patients is residents is the most important. And then getting everyone you can vaccinated, so bringing up that herd immunity. We know that children can still transmit this. Generally, they don't get as ill when they do get COVID. We know they're at lower risk. And if we have the adults and most vulnerable protected, then you're really decreasing your risk quite a bit. It's not zero by any stretch, but it is improved. And I think, again, it's that risk benefit of getting the kids back in social situations and back in school and learning that we kind of at this point think is worthwhile, especially in a community like yours where your vaccination rates are up so high. So I hope that helped.
Hi, this is Lena. I'll jump in. I've asked this question before, but I know the responses to questions can change as, you know, our immunity changes and as knowledge changes with such a new virus. But I work to support pregnant people and breastfeeding people, and I've gotten a lot of questions from these folks about, is it safe for me to take the vaccine while I'm pregnant or while I'm breastfeeding? And I would just love to know if you have any new information to share about that for this particular population.
So Lena, this is a great question, and I'll kind of start, and if Ellen has anything to add in the end, that would be great. So this is a very complicated decision for any woman to make. Of course, we take it very seriously as a medical community. In the initial trials, they don't initially enroll pregnant women. They kind of say pregnant women and children for the second trials that happen. However, we know that there were multiple women that got pregnant throughout the trials. So we do have some data during the trials from that. And we also, in that Be Safe, that safety tracking app, we have over 50,000 women in the US that were pregnant and vaccinated that we have safety data back from. The World Health Organization, the CDC, all the major OBGYN societies have stated that they feel that the vaccines are safe in pregnancy. There is no theoretical risk during pregnancy or breastfeeding. And so they're encouraging women to get vaccinated, and of course having a discussion with your OB or family provider is important to, you know, judge your own risk with that. In terms of passing on immunity to your baby, we've got really, really exciting new news. So this is maybe, Lena, what you haven't heard yet, I'm hoping. So there's been a couple observational studies that have recently come out in the last week to week and a half. And so a small study of 20 women that got vaccinated when their babies were born, all 20 babies had antibodies to the COVID virus. So that immunity passed on, and also they had antibodies in their breast milk. So there's been another small study like that with the same kind of results. So we're super excited about that, encouraged about that, because as you know, when infants are born, their immune system isn't super strong. They kind of rely on mom's immune system in those first few months. So yeah, that's probably the newest exciting news I have.
And I'll just add, I won't say who, but I do have two very good girlfriends who are both expecting and both opted to get the vaccine and are both doing incredibly well. And, you know, maybe Dr. Hodges, I know that she had seen how pregnant women in particular are highly vulnerable to severe COVID.
Yeah, and I agree with everything that Lisa said and Tiffany said. And when I would add that, we have had several women in our region with severe COVID who are pregnant. There's something about the state of pregnancy that might make it worse, and I think that's a risk factor. And we have had lots and lots of women opt to get vaccinated to protect themselves. And I think that, again, it's a complicated decision that you have to kind of weigh a lot of different things. And having a conversation with someone that you trust, a healthcare professional that you trust, is a really good idea to get that kicked off. And I also agree that news about the antibodies in the babies and the antibodies in the breast milk was just such wonderful news. It helps us all a little bit as we sort of tangle with these difficult decisions.
And I just have a quick follow-up. So is the recommendation that during any stage of pregnancy it's okay, or is there specific instruction for first trimester, second, third?
So Lena, any stage of pregnancy, before you're about to get pregnant, during, each will offer protection. So yeah, no specific recommendations, because there's really no theoretical safety concerns in any trimester for this vaccine. So yeah, encourage people to get vaccinated, but again, having that talk with their trusted professional.
Agreed. Thank you so much.
And don't be shy, guys. You're going easy on us. We like lots of hard questions.
Yeah, so I guess I'll share another question I've been hearing in through conversations and such. But I know that Alaska is really leading the nation in this vaccine rollout, and it's mostly in part of our tribal leaders doing that. And I'm just curious how you see this being connected to our Alaska Native values, and how our communities, that community care is really a big piece of this. So Tiffany, maybe you'd like to answer that one.
Yeah, I think you saw the wheels turning in my mind. I have to give the biggest shout out to Southeast Alaska Regional Health Consortium and the foresight that they have in upholding cultural values as a tribal health organization. Certainly my home region has been doing incredible work in vaccinating anyone 16 and older, regardless of their IHS beneficiary status, since the month of January. But that's not the case. That hadn't been the case for a lot of communities outside of some of those rural hubs, or an association with an IHS beneficiary in some larger communities like Anchorage, and even here in Juneau. And so when I came down here for the legislative session to Juneau, there was still a bit of a tight restriction in vaccine availability, and there are a lot of nonpartisan staff that work in the Capitol building that are required to be here in person. There were a lot of legislative staff that are required to work in close quarters in person. Some legislators have opted to make a decision about whether or not to mask in their small office environments, and not wear masks, or to wear masks, and that led to an outbreak in the building. And we saw how quickly that can spread, and some concern for me was coming from my region and coming out of COVID-19 response work to see such a relaxed approach to preventing COVID-19 in the building made me highly concerned. Through some dialogue with tribal health leaders that some legislators in the building had, that the city and borough of Juneau had, Search made part of its IHS allocation available to members of the Capitol, to members and staff of the Capitol building. So 450 people in this building that has not fully transitioned to a remote work environment, where we saw an outbreak occur, where we see ongoing infections happening, where some serious COVID infections that we've seen reported in the news occur. It makes me so proud to be a tribal health beneficiary, to know that Search, in upholding cultural values of sharing, of taking care of one another, of making sure that we're all safe, would extend so generously a portion of its allocation in absence of state allocation to vaccinate members and staff of the Capitol building.
Yes, Quiana, for the answer. I think that is so amazing. I see another question down here. Kelsey, did you want to jump in and ask that?
Yeah, so I live here in Anchorage and my family is in Bethel. And I know I've heard this similar question being wondered by folks who live in different towns from their families, who haven't seen families. And I haven't seen my family in over a year. And this is probably the longest in my entire life that I haven't seen my family. And some of my friends are in the same boat as we live, in Anchorage, or somebody lives in Nome or Bethel or wherever. And we have families in different communities What would you say is the recommendation for traveling to visit each other? So, my dad lives in Bethel. He's fully vaccinated. Our family is working on getting vaccinated as well. Would you say that that is okay for us to travel to be able to see each other? Like if he came to Anchorage, would you recommend that he still quarantine until a negative test? How does that work?
So I can try to tackle that. I think we're starting to see these areas, especially travel, people getting together, that we can loosen these up. So with your father being vaccinated and your family starting to be vaccinated, now there's an opportunity where you can get together. I think you still have to weigh his risk. I'm assuming he's a little bit older. There's still inherent risk of travel, being on a plane. We know even though he's vaccinated, they're not perfect, and there's a few people that will still get COVID despite vaccination. So these are all things to kind of weigh as you're deciding on travel. I think keeping up with the travel guidelines on getting tested, and he would probably not need to quarantine when he arrived in Anchorage because he has been vaccinated, but he would monitor for symptoms closely. And then still when he's going out in public, all those things, wearing masks and social distancing. But I think there's an opportunity for you guys to get together and do it safely. And it's really each family has to make that risk decision, and giving yourselves this information and education is going to help people make that decision. So that's a great question, because I'm sure you'd love to see your dad and he'd love to see you. That's a long time.
Thank you.
Maybe while we wait for a question, I'll ask one of our physicians. As we've seen a rise in variants and the mutation of the virus occurring, there's been ongoing conversations among pharmaceutical manufacturers about the development of booster shots. I know that we're still working on the wave of more widespread availability of the vaccine, but can you speak to, does it appear at this point that there will need to be a development of a booster, and what research looks like for lasting immunity?
So great question, Tiffany. And I think one that's going to be important to all of us moving ahead. I do know that all three of our vaccine manufacturers that are approved in the United States right now are currently developing booster shots and testing those with lab variants that they've gotten from different variants around the country. And we've seen varying responses with their current vaccination to the variants, and so they're fine-tuning that. Nobody has said there's going to be a booster or will need it, but I can tell you, and this is coming from me personally, not from the state, we're going to need boosters, I think. And I'm imagining it will be almost like a flu shot in this first little bit, where maybe once a year we're having to get a vaccination kind of update booster shot. But again, we don't know yet. That's not currently the practice, but it's enough of a concern that all the drug companies are working on that, because we want to make sure that we can protect people from all the variants. We know that the original or native COVID that came to the US is now going to be not the main strain anymore. So some of these other variants are going to be the main circulating strain of COVID. So it does become important when we think of it like that. There was a second part to your question, Tiffany. Oh, lasting immunity. Yes. So, and this really is the million-dollar question. And the answer is we don't know yet. We do know from preliminary studies that people that get COVID and develop natural immunity seem to have a less protection than people that get vaccinated immunity. So people that get immunity from their vaccination seems to have a little more robust antibody production and may protect a little better. there's speculation that it will also have longer protection, but we just don't know yet. So we're still collecting all that data, even from the original trial participants. They're still collecting that data so we can figure out how long we really are protected, but we don't know yet. So yeah, hopefully soon.
Thank you. I see
Hi,
Dorothy.
Tiffany.
I see Dorothy coming off of mute. Dorothy, do you have a question?
Yes, thank you. Hi, Tiffany. Excuse me. Hi, Tiffany. Hi, everyone. Doctors, thank you so much for your time. I really appreciate it. I have a question in regards to what I heard from, I guess it was the CDC last night on the news. They were talking about families who are vaccinated can all meet together. And then they mentioned families who aren't vaccinated, they can also meet with the families that are vaccinated. And maybe if you can clarify that, and if you heard that.
Yeah, I can clarify that a little bit, and it's a little narrower scope than that, Dorothy. So what the CDC has said is that a vaccinated family or person can meet indoors with another family that might have some unvaccinated people in that family, but only from one household. And they can meet together inside without masks on. So it's not a bunch of families together that aren't vaccinated. It's one vaccinated family can meet with another one that might have some people not vaccinated in it. Does that help clarify that? And Tony, if you can put
Yes.
recommendations in the chat box, if you have those handy, that might help people.
And Dorothy, this is Ellen. I like to sometimes think of it as households because especially in my region, families are spread out over, dozens of households or the entire village. So I like to think of it as households. Try not to mix more than one other household with you if you have a mix of unvaccinated people. That'll just, in this period of transition while we await for the virus to die down and we're waiting for immunity, try to limit the number of households that get together.
Okay, I'm sorry. Say that again about households.
Oh, I was seeing, in my region, I like to think of it because people can have families that are in many different households. Large families are such an important value out here. And coming from a large family myself, I really appreciate that. But we'd like to limit it to limit the number of households that get together, even if you have families spread out over many different households. So trying to limit the number of people who get together from different households, even if it's the same family. I think that's important too, especially if there are people in that mix who are not vaccinated, or elderly people who have chosen not to become vaccinated. That's another really important thing to just to try to keep that group of people safe.
Okay, thank you.
Yeah, I think I'm kind of in the same boat as Dorothy. I have 3 teenagers or 3 young adults, and they would all like to at least, have a friend that they can visit. And so that could potentially be 3 households, I suppose. And so, trying to navigate that we're all trying to do right now, and to decide, who can visit who. I guess as far as they're vaccinated, then that would be okay. So yeah, thank you. We're all trying to figure this out, and we're doing this out of love for our community. So I saw another question in here from Brandon. Brandon, did you want to jump on and ask your question?
Sure. I work at the municipality of Anchorage in their innovation team, and I've been working on Anchorage COVIDvaccine.org that kind of consolidates some of the appointments. And I was just curious if people that are interested in getting a vaccine but haven't done it yet, if people on the call have heard of any barriers of transportation or language or insurance or anything. I know there'll be people that don't want to get the vaccine, but we're trying to figure out how to how to make things easier so those people that just need a slight nudge can get a vaccine. So I was just curious what people had heard.
So I certainly will defer to Dr. Rabinowitz to know from the state's perspective, but I had heard that there were some community members that had challenges with navigating the online forms for the state's COVID Vax website. And they've done a really brilliant job, I think, in developing campaign materials that recommend younger members of families helping to navigate those online systems. And I put in the chat box, and I know Kelsey was putting these all on Facebook as well. A lot of tribal health facilities have also used those online forms for registering for a vaccination appointment. In my home region in the Waikiki Delta, in addition to that, we have a COVID-19 hotline. So if people have questions, they can give a call, and there's phone numbers that they can talk to a live person on the other end of the phone who can help get an elder or somebody registered for a vaccination appointment. And so I think that there are a lot of regions that have been really creative in creating those systems for people that maybe don't have access to a smartphone, maybe they don't have reliable data, and the best thing and easiest thing for them to do is simply call their village clinic or to call a hotline that's been set up. I know that in our region as well, we have also started doing vaccinations at the local grocery store. Early in the pandemic, we had been doing mobile testing, so taking a mobile vehicle out to different neighborhoods and setting up in one parking lot to do widespread testing for people who have transportation challenges. And I anticipate that there will likely be similar efforts related to vaccinations. But I think that all of those barriers are certainly things that could probably be more pronounced in larger communities, but those are some of the creative solutions, at least that we implemented in our region to deal with them.
Thank you.
Yeah, I would also like to jump in to help answer that. But Native Peoples Action has been working with ACPERG, and we have a group of language experts that have come together, and they're creating information for all of the different regions in the languages about COVID vaccination. So those will be rolling out soon. I know they've been putting a lot of time and effort in and love and care into those messages. So I wanted to share that that's happening too. And they've also been invited today, so they may be viewing on Facebook. So I just wanted to give a shout out to them, that their work is so incredibly important as well. And I see another question coming from Kelsey. Kelsey, did you want to ask that?
Yeah, I just, I know this is probably like a long ways away, but you know, we really do our part to wear our masks, even when we're like pumping gas at the gas station and everything. And my daughter is so cute now. Every time we leave the house, she's like, "Do you have your mask?" She's like very persistent about it. But I just wonder, like, do you have any insight of when we get to this place of herd immunity, what that might look like for us in regards to wearing our masks out or not wearing our masks out in public again? I know it'll take quite a while for us to get there probably, but just wondering if you have any insight about that.
So I think, Kelsey, you answered your question perfectly. It's going to take a while. We don't know yet, but assuming we get to that kind of herd immunity, 70 to 80+%, that's when we can start considering, in public places, not wearing a mask. I think for a lot of people, it's going to take even longer than that to get comfortable with it. It's funny that you mentioned that your daughter is much better about it. I think across the board, kids are much better at it. Adults are notoriously bad at it. And my daughter in school says it's always the teachers that take their mask down to talk to the kids. So I think it's, as adults, we get set in our way. But I think we all want to get back to seeing each other's faces. But I think you're right. It's going to be a while before we get there.
Brianna, Kelsey, such good questions. I wanted to relay a question about mental health, and this 2020, like we hear all the time, 2020 has been pretty difficult, and going into 2021, and just all of the social distancing, not seeing family. I know that there's anxiety about going into public spaces. And what can you share about maybe some reassurances, with getting the vaccine and being able to, be safe going out to go grocery shopping or going to the post office or going to your doctor's appointments, with anything like that that might help people who are experiencing anxiety about kind of going back out into the community.
Yeah, I think it's important to remember, back to the first part of our talk, these vaccines are very, very effective. And so when you're vaccinated, your protection level is very high. So in terms of anxiety, personally, on going back to the community, all those things, it's important to just remember that. I think when you were first asking that question, I thought about, we've been working a lot with the long-term care assisted living facilities. And a lot of those residents hadn't seen their families in a year. And I think, a lot of those residents had dementia, and they're now starting to have visitations back in the nursing homes once they get to a certain level of vaccination. And seeing those residents hug their families again, and how meaningful that is, and how the assisted livings had relayed how much health and mental health deterioration had happened without that kind of family love and support. That's the perfect example of once we get vaccinated, we can get back together with our loved ones, and that is so important to everyone. So yeah, great question.
And I put in the chat box, YKHC's Jolly Jarak program had pulled together a lot of wisdom from Yupik elders about cultural practices and resiliency work that can support people's behavioral health and anxiety during the pandemic. And I think that is a really helpful tool and a good reminder just for how to stay grounded and centered during an uncertain time. So if people are interested in that, I put the link in the chat box.
That's great. And I saw another question in here about almost half of the kids who aren't eligible yet make up many of these regions in Alaska. So the timeline on kind of kid vaccines. And I do have a little bit of new information on that. We do know that Moderna and Pfizer are both having trials with children. And they both met their quota of kids enrolled in their studies. So that means now those studies can move forward. So we anticipate getting information, and those are 12 and older studies. So we anticipate getting that in the next couple months. It's also important to note that Moderna has just opened their study for 6 months above. That will start enrollment now. And that will take a while to get all the children enrolled before they can start that phase of the study. But it's stuff coming down the pipe. It gives us some encouragement that first it will be 12 and older that can get vaccinated, and then younger than that following.
Yes, well, thank you so much for being here, Quiana, Masicho, Anabasi, Gonalchish. We appreciate that so much. Lena, did you want to share in closing?
Thank you guys so much for sharing your expertise, and just, we know that things are changing so quickly, so having access to good, reliable, up-to-date information is so important for all of us as we make our individual choices. And we're just really grateful for your time today. Thank you so much for all that you're doing to keep us well and healthy. And thanks to everyone who joined us today.
Thanks for having us. We appreciate it. And thanks for everything that you all are doing throughout all of Alaska. And keep talking to everyone about vaccines and educating each other. Thank you. And thanks for everything Tiffany's doing for us down in Juneau, and Ellen making us all look good on the New York Times, rolling out vaccines in the dog sled. Made me proud to be an Alaska woman. So keep up the good work.
Yes, thank you, everyone. Remember, even though we're socially distancing, we're still in community together. So practice your wellness and take care of each other. See you next time. Bye.
Ayana, bye.
Kuleana.